Thank you, Mr. Chairman. The pandemic has had many dire outcomes for students of all ages, not the least of which is rapidly deteriorating mental health. The number of young people contemplating suicide during the pandemic is tragic, and we have an opportunity with this amendment to support them. A study by the American Academy of Pediatrics found that higher rates of suicide-related behaviors in youth corresponded with COVID-19 stressors and community response to those stressors, such as school closures. A special report by the American Psychological Association quotes a mental health expert saying, "We can reasonably anticipate increases in anxiety, depression, trauma, and it goes without saying there will be significant grief and loss issues. We can also anticipate increases in child abuse and neglect." Last summer, I spoke about the increasing mental health issues in our youth and often was dismissed and was asked about facts. Let me give you a fact. New York Times article 12421 regarding Nevada. Between March 16th and June 30th, 6 students committed suicide. Between July 1st and December 31st, 12 students committed suicide, the youngest of which was 9 years old. This forced the Las Vegas school system to reopen in January. Through this amendment, the Secretary of Education shall reserve 2% of the total appropriated amounts before providing grants to states in accordance with the same terms and conditions that apply to the Elementary and Secondary School Education Emergency Relief Fund for awards of competitive grants to local educational agencies to provide mental health services and service to schools. Similarly, an additional 2% shall be reserved before making allocations to institutions of higher education in the same terms and conditions that apply to the Higher Education Emergency Relief Fund for a 3-year competitive grant program for institutions of higher education to establish or support existing mental health centers on campus or to provide mental health services and supports to students. We cannot ignore cries of help from our nation's students. As we work to overcome this COVID-19 pandemic, we must address the increased need for mental health services in elementary and secondary schools, as well as colleges and universities. There is much in this markup amendment that is tangentially related to the COVID-19 pandemic, but deteriorating mental health in our youth is not. I think this amendment would be bipartisan if we had the opportunity to carefully review and develop this proposal. I hope that I will get bipartisan support to help students address their mental health needs. I urge my colleagues to support this amendment, and I yield back my time.